Okay, if we're looking at the heart, where we've kind of cut is about there, I think. And the heart sits at this angle like Michelle was talking about. So when you do your apical four-chamber view, you have to do a little bit of rotation, right? To try and get a four-chamber view from your subcostal view. And we talk about these longitudinal muscle fibers going from apex to base, right? But if I hold it at the side like that, those muscle fibers are going in that orientation, okay? So blood flow is coming in through there. It's almost like in the direction that we did this slice, which is diagonally, but they go out through there. And this brings us on to, again, when we talk about TAPSE being kind of, you know, one of the mainstays that we assess RV function, it sure as hell isn't perfect. Because a lot of the actual power of the right ventricle comes from the twisting of the heart. And they talk about the septum being the lion of the right ventricle. And if you can imagine these insertion points that if you fold back, this insertion points of these free wall into the septum, provide an enormous fulcrum for power to be generated. So if you can imagine that heart twisting, you'd have those, as the heart twists, those two areas which the RV free wall is attached to the septum, they get a little bit bigger because that heart sort of twists. And that squashes, almost like pulls in that right ventricle free wall as well. So you get this bellows function. It's also a really important part of RV function.